And to discuss whether the NHS can survive without migration is same-day doctor, GP Laurence Gerlis. Welcome to the show, Laurence. Thank you very much for joining us. So we're just talking there about the number of skilled visa applications. It is 322,000, up 87,000, and including 154,000 dependents. And of course, a tranche of that, a large tranche, are people coming in to work for the NHS. So the question is, can the NHS survive without importing nurses and doctors from abroad, or should we actually be training British nurses and doctors up in the first place instead?
Well, I know a lot of foreign medical and nursing graduates are upset by this debate and feel that they're being unfairly singled out. And we do depend a lot on overseas trained staff to run the health service. I always think it's unfair to steal staff from poorer countries. Look, if the population's increased, I'm not political at all, but if the population's increased, we've got to improve the infrastructure. The problem, as I see it, is we're asking the wrong questions. We should be doing better at retaining staff retention, so we don't have to replace them so often. There's a terrible shortage of GPs, but in fact, hospital staff, number of hospital doctors is 30% up on 10 years ago. But we're less efficient, they're less productive, and not because they're lazy, because the health service is 75 years old, and it functions like a car would if it was 75 years old. It just doesn't work. So in answer to your question, can we sustain the NHS? I don't think we can sustain the NHS anyway. I think it's broken and has been for a long time. And to some extent, I think the public should be calling for a change rather than just saying more funding, let's make it work. Because you and I know if you throw money at the health service, it's not going to make any difference.
And so, of course, relying on imported labour for the NHS, you're saying, is a sticking plaster solution. What kind of root and branch reform would you like to see then instead?
What I'd like to see is the sort of system they have in Australia, Germany and France. Now, I know that that's anathema to a lot of people because it involves social insurance. It does provide a safety net for the elderly and for people who cannot afford to take out insurance and cannot afford to pay. It can be run as a fair, equitable system. But every time I mention this, people talk about, well, it increases inequality. And there is no will within the general public, or certainly even within the political parties, to make such a radical change. It frustrates me that we cannot do anything really radical in this country, even when it's something to improve the lives of everyone. I mean, just to give you an example, Martin, to start off, my own personal hobby horse, 90% of prescriptions in this country are dispensed free of charge. Despite, although some people are exempt, there's widespread fraud, and medicine cabinets all over the country are full of expensive medicines that are going to waste. That's just one example of how we run this thing, and we run it badly.
But of course, Laurence, those from the political left, certainly the Labour Party, would say if we stopped importing nurses and doctors, the NHS would simply collapse. Are you saying that's going to happen irrespective of that?
Well, yes, I think the NHS is collapsing now, and we're coming into December, and as you know, there'll be another winter crisis. There's bound to be. There's going to be probably a flu epidemic. People forget that actually quite a lot of staff take their holidays over Christmas. It's never mentioned when we see the bed crisis over Christmas. It's actually one of the reasons for that is huge numbers of staff take annual leave at the same time, and it becomes a sort of Christmas Day service for 2 weeks in effect. So yes, I think the health service is failing anyway. If we retained our staff better, we wouldn't need to steal them from other countries. And as you said, stealing those staff, it doesn't solve the problem. It just puts the problem off for another day. We need to reform the health service. And I ask the public to ask for it. We're never going to get the politicians to do this. We're never going to get the medical profession to do this. I think the public should be demanding a reform.
Laurence, one thing that always intrigues me is how we're always accused of imperialism or empire if we take things from abroad and bring them back to Britain, yet the Liberals, those on the political left, seem to have no such compunction when we are taking the finest trained medical staff from India, from Nigeria, from the Philippines, from Thailand, and bringing them to Britain, and therefore, by dint of logic, depleting those countries of the best healthcare for their citizens.
Exactly so, Martin, and no one ever asked that particular question. And you will know that for every medical school place there are probably 6 or 7 applications in the UK, but we turn away bright, ambitious young students who want to be doctors because we don't provide enough training places for medical students, because it's actually cheaper to import doctors from third world countries and to train them ourselves. And that's been the case for as long as I've been a doctor, which, as you can imagine, is quite a long time. You know, we just don't train enough doctors, and we should. We should be doing that. And we should be training our own staff. Yeah.
I think a lot of people agree with that. Same day Dr. GP Laurence Gerlis, thank you very much for joining us on GB News.